This session is about the use of the discharge and planning orders in this section of the discharge routine. You can see it's under the section of stuff physicians must do. It has the red asterisk here indicating this is a required field prior to the patient going home. Let's click on into the blue New button here. This takes you into the usual CPOE module. This should look pretty familiar. You can see it's defaulted to orders by name. You can also see that it's filtered on the word discharge. Those of you who have been using these discharge orders in CPOE to discharge your patients, these kind of legacy discharge orders, you can continue to use these. They'll continue to work as they have. No problem with that. They just don't have some of the functionality. We couldn't build the functionality in to the same way that we have it in these two new orders here. So this session will focus on the use of these two orders. So the discharge planning order, and it includes some patient instructions if you want to, is something that's intended to be done in advance of the day of discharge. The earlier we can start on these things, the more likely it is to get done correctly. And then the discharge order official is the one that counts as, this is the official discharge order for the patient going home. This is required by the regulation, and health information management bird dogs this pretty aggressively. So discharge planning and instructions. Let's go on into that order, pretending that I'm going to discharge this patient tomorrow. Or rather, I'm getting the patient ready for discharge tomorrow. Maybe a partner of mine is covering tomorrow and I want to make it easy for him or her. So let's go on into that discharge planning order, and you'll see that there are several fields here. This is a typical nursing order, and as with most of those, don't get too bogged down into this top screen, but rather focus on the action areas which are lower down. Physician follow-ups. So this is basically an order for nursing or clerical staff to go and schedule follow-up appointments with desired providers. In 2 weeks, Dr. Jones, in 2 months, and you could put something generic in there as well, like follow-up pulmonology. Whoops, pulmonology. Sorry, and the folks will then call the appropriate clinic and schedule the appointment. The nice thing about the discharge routine is that these orders, it's been hard to tell in the past whether or not those are done. Sometimes they're tucked away in odd little places, or it's hard to, you don't really know where to look, but in the discharge routine this information will end up coming back around and be easily visible to you. The follow-up labs or diagnostics, that would be something like PT-INR in 3 days, result called to Dr. Q. You'll notice here that this is in asterisks, enclosed in asterisk, this entreaty to include the diagnosis or reason for the exam. The lab or the radiology department cannot bill for these procedures if they don't have a reason for the exam or diagnosis incorporated into their charge submission. So your office may have gotten calls back about this, you just may not be aware of it, but this is an opportunity to reduce callbacks if you just add in something like diagnosis, atrial fib, or DVT, whatever the diagnosis is. And then other orders for staff to carry out. So again, the way to think about this is something that I want somebody in the hospital to do prior to the patient going home. So this could be teach patient on train care, give instruction sheet for lap chole, or set up for home hospital bed, or home health PT. You get the idea. The next two fields here, diet and activity, would be, sort of 2 gram sodium, consistent carb, moderate, low potassium. And then activity would be toe touch, weight bearing, left lower extremity. But I made these purposefully clinical because these two fields are ones that go to the nursing task list. Nurses will translate this into patient-friendly language and put it onto the patient's discharge instructions that they go home with. this bottom box is unlike those others above there. This is not something that flows to hospital staff to execute as an order. Rather, these are instructions that will flow to the patient, discharge instructions. So type this in patient-friendly language as indicated here. So this would be quit smoking, or you may shower on Thursday, or return to ED for recurrent chest pain, whatever you think appropriate, and that you'd want well, actually, that's a good example, right? I should not have put CP in there for patient-friendly instructions. Recurrent chest pain. Even the word recurrent may not be appropriate. You get the idea. So let's go ahead and file this. This is a regular CPOE order, so it's in the new order queue, but it's not been saved yet. So that's one little trick. You need to remember to go ahead and save this. So go ahead and put my pen in. And now that's been filed, and it's shooting off to go to the nursing and clerical task lists. You'll see here back in the discharge routine that whereas this used to be low lit with just some bland instructions, now you can see that this order lives in this spot, and I can go back in there and can see the guts of the stuff that's already been typed by me or anybody else who's placed one of these. Let's go back out to the discharge routine. So this was done, say, on Thursday, and then the patient's going to be going home tomorrow. Now it's the next day, it's Friday, I'm the discharging doc. I'm going to go down here, I'm going to place the official discharge order. Again, this has to be done prior to discharge. So let's look at the guts of this one. A couple of different things. The reason for visit. So again, this is a patient-friendly reason for visit. So there may be a patient who could understand congestive heart failure. This is different from the problem list, though, because the problem list is medical speak, and a lot of our patients can't follow that, so this is the opportunity to make it patient-friendly. Or you might say, blood clot in leg rather than DVT. You get the idea. Or total hip replacement rather than hip arthroplasty. This field here is an order to the nursing staff not to discharge the patient until something else has happened. This is a contingency. So this could be until seen by cardiology to decide on medication X, or until able to tolerate solid food. Sorry for the little typo. So you don't have to put in another discharge order after this. Rather, this acts as the discharge order with this contingency embedded in it. And unfortunately, here's another asterisk. You have to put in the discharge to location, whether it's home or a nursing home. You get the idea. Unfortunately, it's a required field as well. Here's a nice thing. So the stuff that we've done ahead of time as discharge planning populates these fields automatically. So this doesn't need to be redone. And it may be you have an opportunity to certainly edit that. Maybe you decided they don't need that, and it's the weekend is here and you want to give people another day, so you can change that. You can edit these entries, but they're there teed up for easy filing. So go ahead and file that. Now it's in here. I still have to save it again. Now that's done. So we've done some planning orders and the official discharge order.